Hello students, today's lesson will focus on Unit 2, Prioritization and Time Management, which is associated with the end of program Student Learning Outcomes number 3 and 5, applying principles of prioritization when evaluating nursing care in complex situations. The required reading for this unit is covered in Chapter 25 of the Cherry and Jacob book. The learning objectives include identifying principles of priority setting for patient care management by the RN, describe a framework for making decisions and setting priorities, prioritize patient care assignments correctly utilizing different frameworks, discuss principles of time management to organize nursing care in relation to prioritization, discuss successful strategies for time management in the healthcare setting, examine barriers to effective time management, and demonstrate the use of critical thinking in complex clinical situations. Priority setting. How should you best utilize your time and what should you do first? Our performance is most influenced by what we do with our time and how we prioritize our responsibilities. Establishing priorities is an essential step in controlling your time. It is important to get into the habit of priority setting, asking yourself what should you do first and strategizing about how you can best utilize your time. To prioritize effectively, you need to recognize what is important as well as understand the difference between what is urgent. And something that is important would be a task that usually you have some type of flexibility in completing that task versus an urgent task is something that needs to be completed right away. Frameworks for prioritization. There are different frameworks for prioritizing your time. In terms of caring for patients, you will likely need to divide your time based on a patient's acuity. For example, you can use a nursing diagnosis ranking system, allowing you to separate patient care into high, medium, and low assignments. So this type of ranking system or acuity scale is often used by a nurse manager or charge nurse to divide out patient assignments. Maslow's hierarchy of needs is another nursing prioritization framework, and it is divided up into 5 categories and is often depicted in a pyramid and where you work your way from the bottom to the top of the hierarchy of needs. So the first category covers psychological needs, which refers to things we need to live and survive, like air, water, and food. The second category is safety, which refers to things like being free from harm and having adequate shelter. The third category is love and belonging, and this includes the need for affection and belonging to a group, like a family. The fourth category is esteem. This includes self-esteem and approval from others, so feeling respected and confident. And the fifth category of Maslow's hierarchy of needs is self-actualization, which means meeting an individual's full potential. Oftentimes, there will be many potential nursing actions needed, but the nurse must be able to distinguish the first among them and then to rank them accordingly by priority. Nurses can use Maslow's pyramid to remind themselves which nursing actions are priority, starting from the bottom of the pyramid. Another way to prioritize nursing care will be to focus on the ABCDEs, which stands for airway, breathing, circulation, disability, exposure, and environmental control, and I will cover this in a little more detail in one of the upcoming slides. Levels of priority. When evaluating how you should respond to situations from a clinical perspective, it will be important to categorize activities by levels of priority. High priority would include life-threatening or potentially life-threatening events, and this is where the ABCDE system can be very effective. Medium priority would include activities essential to safety or problems which may result in delayed development or cause destructive physical or emotional changes, such as a delay in medication administration for a stable patient. Low priority would include activities that are essential to care or require minimal nursing support, like activities of daily living. This slide depicts the ABCDEs, which is a very helpful assessment system that you can use for caring for acutely ill patients, or even when you have several patients and you're unsure of which patient's care to prioritize first. So you would start by prioritizing the patient's airway. Is the patient airway safe and patent? Is the patient having any respiratory distress? Is there any trauma to the cervical spine requiring immediate stabilization or immobilization? Next, you would assess breathing, assessing ventilation, use of accessory muscles. Does the patient have lung sounds? And then you would move to circulation, assessing carotid or femoral pulse, capillary refill. Is there any bleeding? What's the patient's blood pressure like? Is the patient experiencing any cardiovascular shock? And then you would move on to disability. So is there any neurologic decline, including a change in the patient's consciousness? AVPU, so is the patient alert to voice, to pain, or is the patient unresponsive? Does the patient show any deformities, any major injuries, any mobility concerns for that patient? And then you would assess exposure and environmental control. So this is where you would do your head-to-toe examination. You would also assess that patient's temperature. Application of the ABCDEs is very important. So imagine that one of your patient needs a PRN for pain medication and you have another patient that requires an IV bolus of normal saline for dehydration. The ABCDEs of priority setting dictates that the circulatory priority of volume resuscitation needs to be done first. The priority of pain medication, which falls under D for disability, would be done second. So that's just an example of how you can use the ABCDE system to prioritize patient care. Additional principles to consider when prioritizing your nursing time would include the client's health values and beliefs, the client's priorities, any resources that you need or the resources that are actually available. So you want to think about if you're going to provide a certain level of care to the patient, do you have the appropriate equipment, the appropriate materials, do you have staff to support you? You also want to consider the urgency of the health problem as well as the patient's medical treatment plan. Look at the big picture. Think about how do you get it all done? What must be done? What can be handed off? What can be delegated? What can the patient do independently? So this is where it's really important for you to understand the difference between things that need to be done urgently versus something that's important and it needs to get done. And this is where also utilizing some of the strategies that we just discussed, so the Maslow's hierarchy of needs, as well as the ABCDE. So think about some of the strategies you can actually use to prioritize and to manage your time as a professional nurse. Time management. According to Cherry and Jacob, time management is about developing processes and tools that increase efficiency and productivity within the set standard of time. Box 25.1 in the Cherry and Jacob book represents internal and external time and energy distractions or time wasters, such as taking on too many tasks at once, an inability to say no, procrastination, complaining, perfectionism, interruptions, disorganization, and too much information overload. Time management strategies. Time management is about planning, organizing, and implementing strategies to control the use of our time. Planning is the most important step in time management. It is important to engage in planning before beginning any task, project, or the day's activities. Planning requires priority setting, scheduling activities, and making to-do lists. A Cardex or nursing daily routine or checklist sheet can be very helpful in planning your day and helping you stay on task. Each day needs to start with a plan for what you need to do for yourself and your patients. You also need to make sure that the goals you set are realistic and timely. Organizing your internal and external environment is an important component of time management. You can maintain order by avoiding the stacked desk syndrome. Keep your workspace and patient rooms free of clutter. Organize your clipboard and write things down so that you can communicate in a concise and logical fashion. Also, eliminating clutter from your patient's room will allow you to provide more efficient patient care. Practice no detourism to organize your mind. We're not as skilled at multitasking as we think we are, so it'll be very important for you to concentrate on one activity at a time whenever possible to avoid oversights and gross errors. Learn the art of wastebasketry, which is figuring out what information or details you need to maintain good patient care. Avoid email mania. Understand the difference between priority emails and junk emails. Also, try to conduct as much business in person or over the phone as possible to ensure prompt closure of a situation. Implementing control is another time management strategy that focuses on carrying out activities to assist yourself and others with managing time. Steps toward implementation include attacking priorities, finding extra time, handling paperwork appropriately, avoiding procrastination, delegating appropriately, controlling interruptions, learning the art of saying no, rewarding yourself, using technology, and deciding which tasks are non-essential. Controlling interruptions. Interruptions cannot always be avoided, but the goal is to control those you can. One way to do this is by establishing no interruption blocks of time. For example, you have to complete a 30-minute dressing change. You can inform the charge nurse to take any incoming calls for you and ask for your nursing assistant to round on your other patients while you are busy. You can ask not to be interrupted during med passes, patient teaching sessions, when you are starting a new IV, or another activity that may require protected time. Communication is key here. Let the rest of your team know that you will be busy and how much time you will need to complete the task. Learn to say no. First decide when to say no, then decide how to say no. There's no need to provide an elaborate qualifier to your no response, but be clear. However, it is also important to say yes when you have the time and skills to assist someone else. Considerations for continued success with time management and prioritization. One of the things that you should consider when feeling overwhelmed is to stop and plan activities. Keep focused on priorities and act accordingly. Remember that you have a team that can help you prioritize. Avoid procrastination, which could be in the form of over-socializing or focusing too much on low priority tasks. Maintain a positive attitude about established goals or revise them so they coincide with your values and the priorities of the patient. Do something for yourself every day. Continue to work on overcoming your fears. Resist doing the easy but unimportant tasks. See box 25-2 in the Cherry and Jacob book for successful time management tips. This slide provides an overview of what was covered for the session today on Unit 2, Time Management and Prioritization. It will be very important for you to go back and review the PowerPoint presentation as well as the Cherry and Jacob readings on these topics. The topics include describing a framework for managing and prioritizing patient care, becoming familiar with the levels of priority for patient care, understanding how priority setting and time management are utilized in patient care, applying the ABCDEs to prioritizing patient care, describing how time management strategies can help you minimize interruptions, explaining barriers or a reason why a nurse may have difficulty with time management, and then reviewing what are some of the time wasters.